my name is Catherine. I'm a PA student, and today we're going to be doing an abdominal exam. So I just washed my hands. We're going to go ahead and talk to our patient. Hi, what's your name?
Taylor.
And how old are you?
I am 33.
Perfect. So today we're going to be doing an abdominal exam. It's going to require some listening, some percussing, some palpating. Is that okay with you?
Yes.
Do you have to use the bathroom before we start this exam?
No.
All right. So I will sanitize. I'm going to go ahead and get you into a more comfortable position. So I'm going to have you bend your knees up like this. Put your arms down at your sides and go ahead and take some nice slow deep breaths through your mouth. This will help relax your abdomen so it'll be easier to do the exam. So now I'm going to just expose your abdomen from the xiphoid process to the pubic rami, but not so exposed since we're going to be on. Okay. Perfect. Thank you. Helping me out here. Thank you very much. So first I'm going to inspect your abdomen for size, shape, and symmetry, looking for any visible masses. And then I'm going to be looking for any scars, striae, dilated veins, any rashes, anything like that. Now I'm going to look for any peristalsis, any abdominal like aortic pulsations, and I'm also going to look for bulging flanks. So if you were kind of bulging at the sides here, it would indicate third spacing of fluid. So now I'm going to go ahead and listen. I'm going to warm up my stethoscope. Alright. We're going to listen to the bell of my stethoscope. Then to your renal arteries,
The 4 quadrants.
and to your cardiac arteries. And I'm just going to have you slowly walk a bit.
Yeah. That's what I'm doing. I just forget.
Yeah. Not get over the scale. That was really good. Okay. I watched the 50 questions he has, and they're pretty good. So I'm going to go ahead and start these back up. And now I'm going to listen to the different quadrants of your abdomen using the diaphragm side.
I didn't even eat my vaccine, and as I approached the rib, I happened to
Is that an egg? That's a raw egg. Like from the midline to like the
said you can't hear.
I know I brought it in.
And now each one of those I should have been listening for a full 30 seconds, but we're not going to do that. Okay, now that I have looked and I have listened, up next we're going to percuss. So I'm actually going to come up to the other side here. And I'm going to start by percussing all the quadrants again. I did 4 quadrants and then 3 in the middle. And now we're going to percuss for your liver. So I'm going to get your bust up here. And it should have a little bit of resonance from your lungs. And then it should change to dull. Now we're back to resonance. So I'm going to have you take a big deep breath in. Breathe normal again, so it's kind of about here, and then I'm going to go across as well. So we'll start over here, where it's resonant, to where it turns up, and then it should go to about here. So a normal liver span would be 10 to 12 centimeters. Smaller than that could be cirrhosis. Larger than that is some sort of hepatomegaly. I'm also going to percuss for your spleen, although normal healthy
So because you're like
Okay, awesome. So up next, what I am going to go ahead and do is my light palpation. So I'm just asked if you had any abdominal pain earlier. Do that before you start all the steps next time.
I do not.
Okay, perfect. So now that I've done light palpation, I'm going to go ahead and do deep palpation. We're checking for any guarding, tenderness, rigidity. Could be voluntary or involuntary guarding. That's why we're having you do those breathing exercises. Now I'm going to go ahead and I'm going to palpate for the liver. That little spot. It's so hot. So it's right along where we percussed it. And then I'm just going to feel for your spleen, even though I did not percuss it earlier. Looking for any splenomegaly. Okay. So now I'm going to just sit the head of the bed up about 45 degrees, and we're going to do Murphy's. So what I'm going to do is I'm going to have you take a breath in, breath out, breath in. And I'm going to press down in the area of your gallbladder. If you were to cease your inspiration, then that would be a positive Murphy's sign, and it would indicate something is going on with your gallbladder. So there's a couple other little tests I'm going to do really quick. So I'm going to check McBurney's plate. So I'm going to push down right here. Any pain? Nope. Okay, if you did, that could be appendicitis. We're going to check Robson's sign, which is the mirror image on the other side. Any pain? Nope. And I'm going to quick release. Any pain? Nope. So I was checking for rebound tenderness. Both of those also for appendicitis. Now we're going to do psoas sign. There's a couple different ways to do it, but the way we're going to do it is I'm just going to bend your knee in. Any pain? Nope. Okay, and then I'm going to go ahead and rotate your leg side to side. This is obturator sign. Any pain? Nope. Okay. Both of those also could indicate appendicitis. Now I'm going to measure your abdominal aorta. So I'm just going to put my hands on either side of it. I'm going to have you take a deep breath in, breath out. And while you do that, I'm just going to press down a little, and I can feel the pulsations of my hands. Sometimes you can see it in my move, but my hands are too stiff right now. Okay. And then I'm going to go ahead and feel for your kidneys. So I'm just putting my hand underneath and pressing down. Same thing on this side. And then the last thing I'm going to do is I'm going to have you sit up. And I'm going to check for any costovertebral angle tenderness. So right here on your back, I'm just going to knock. Any tenderness? And on this side? Okay, if you did, that could indicate something's going on with your kidneys. Do you have any questions?
How wide should my aorta be?
It should be about 2 centimeters. Cool. Did I miss anything, you guys? Awesome. Well, thanks for joining my video. We're getting more in depth on these, so.